is Craig Misrach.
Hi, everyone. Thank you for having us. Ruchi, I believe Bria, my associate, will be sharing screen. There we go. Thank you, everyone, for your time today. My name is Craig Misrach. I'm President and CEO for UpLyft. UpLyft is the world's first independent transfer system from bed to wheelchair for people with limited mobility to use in their home. We also are aiming to become the gold standard of zero lifting assisted transfer for healthcare workers in institutional healthcare facilities. This is a huge problem. There is no technology currently in the world that can allow an individual to transfer from bed to wheelchair on their own. Individuals with limited mobility inherently can have a reduced quality of life and lack of independence. And as it relates to institutional healthcare facilities, physically lifting patients is now the specific cause of $20 billion in workers' compensation claim costs annually. It's the leading cause of workers' compensation claims in the US healthcare system. And why is this? Look at the existing transfer methods that are currently available. I know there's a lot of MDs on this call where you can see these tools used in your facilities. They require caregivers. There's a high risk of injury, immense physical labor, and even the most advanced technologies have patient weight limits of 250 or 300 pounds max. So enter UpLyft. We're going to show you a video demonstration now. This is actually our founder, Anton Simpson. He's 84 years old. He invented UpLyft in his garage, his first prototype, when a dear friend of his got in a car accident, was paralyzed from waist down, and the gentleman's wife could not lift him out of bed. As you see, the finger panels of UpLyft nestle underneath Anton's hamstrings and back. Keep in mind that this is covered UpLyft by 21 patents. 15 of them have already been issued. And as Anton sits upright in UpLyft and transfers over, think of all the individuals this can help. Seniors, folks with obesity challenges, individuals with spinal cord injuries, and our pre-order customers also include those with ALS, muscular dystrophy, multiple sclerosis. I can keep going on and on. Anton's hands on the outside there are simple up, right, up, down, left, right buttons, where a loved one, a family member, a caregiver can use UpLyft as a zero physical lifting assisted transfer aid. And I can show those videos to anyone outside of this pitch. So we have two channels we are commercializing. We have orders today, deposits in hand, pre-order sales for direct to consumer for home use. And the biggest feature is independence. For those with an investor mind, our FDA Class 2 device exemption is huge. It's very rare you can find a company with this level of technological evolution that can start penetrating and selling product this quickly. We have to make sure we're quality control compliant and adhering to good manufacturing practice. Comfort, the speed, this is it's about 2 minute transfer. The cost of this, especially when compared to the annual cost of a caregiver in a home, and peace of mind for family members are all real competitive advantages versus the competitive landscape. In healthcare facilities, again, we're not purporting this to be an independent self-transfer. It's to be used as an assisted transfer with no physical labor. And the key thing I want to emphasize is we bench tested up to 600 pounds. And while our initial products going out are at the 350 pound level, we fully anticipate being able to go up to that weight level as we evolve product. I'm getting a little delay here on the slide moving, sorry.
What if you go back and forth?
Yeah, maybe go ahead one, Bria. Okay, you can go back. Okay, that's fine. So this is a massive market. It's $19 billion in the United States, and that's primarily driven by the 3 million people in the United States the US Census Bureau says need assistance to get out of bed every single day. We conservatively estimate just 1 in 10 beds in US hospitals and nursing homes. At our price point, again, $20 billion total available market. If we just focus direct to consumer, it's still a 10 billion market opportunity, and the global market is 4 times that of the United States. So we have pre-order sales today where consumers are making deposits to purchase UpLyft for cash, anywhere from $6,000 to $8,000. We also have a very attractive leasing and financing strategy for those who can't afford a gross purchase, or as we want to expand and increase an installed base, can create an attractive recurring revenue stream. We also have a short-term rental strategy for end-of-life care. Medical device industry standard, 70% gross margins. And in healthcare facilities, we're already getting requests for additional features. And the training is going to be much more intensive for us as an organization, just because of workflow considerations and other aspects of institutional facilities which drive a higher price point. So the beauty of our direct-to-consumer strategy, which we started in COVID, mostly because we couldn't go into a facility, was we created a novel and proprietary digital marketing funnel and e-commerce platform via our website, social media, Google advertising. And so as we move forward, or when we get inbound leads, it's simply we pick up the phone. We want to understand a little bit about the patient or individual's current condition, and we can close an order on the phone. As we move forward, we plan to expand into direct response television advertising and other media platforms. You may want to click again, Bria, it's catching. So as far as, and these are just some of the examples of some of the tactics we have used for digital marketing. And for example, when we launched, we had over $120,000 of orders that were obtained with less than $10,000 in digital spending, acquisition cost. Now, as we talk about institutional healthcare facilities, the value proposition is threefold. It's about health and safety, zero lifting for healthcare workers and preventing injuries, reducing costs of facilities, whereby we can help lower the amount of workers' compensation claims, the premiums and overages and policy denials. We also want to create a happier workplace where patients can be happier and enjoy the ride, and also employees as it relates to bedside and patient transfer. So this is a slide of our team. Bria, you may want to move forward again or back to the team. So our founder, Anton Simpson, is a technical founder. As I mentioned, he's a great yin to my yang. He's invented multiple products, including that in the medical field, and sold related businesses there too. Bria, the slide's still catching, if you don't mind, and go back to the, there we go. As for myself, I previously founded a diabetes medical device company. We actually were the first company in the world to get FDA clearance for a non-invasive diabetes diagnostic. That technology diagnosed diabetes by shining light in your eye for 6 seconds. We sold thousands of devices around the world and sold that business in 2017. Bria, who you keep hearing me reference, she is the brainchild behind our branding. Everything you see from our name, which is now trademarked, to the colors, to more significantly, our digital marketing platform, our e-commerce, is all from her genius. So here are some of our achievements. As I mentioned, we're now approaching almost 200,000 in pre-orders. I can't emphasize enough how difficult it is for us to get deposits when we don't have product, and that's what we're raising capital for. We have a real nice amalgamation here of appealing medical device aspects of risk reduction and value for investors related to our patents, our device exemption. We even have a Medicare reimbursement pathway that we've identified for pursuit in the second half of the year for electric lifts, which is almost 2 times the amount of the cash pay price to customer. We've secured over $1 million since inception, and we've started manufacturing. We're raising a $5 million Series A round. Some of that goes to some remaining non-recurring engineering to stay FDA compliant with good manufacturing practice, but the rest is to really scale the business, build out a sales force for institutional healthcare sales, and our customer service department to help with our direct-to-consumer. And go one more time, Bria. Try again, back and forth. There we go. And so this is our commercial timeline. As I mentioned, we've raised $1 million. We've done usability studies. So we were making sure we were getting feedback from customers and our potential customers. And we have a continued commitment to conducting those, even though there's no requirement to. It's just to make sure we're really commercializing the right product for our patient population. As I mentioned in Q2, we plan to close our Series A by the beginning of Q2. We have a major institutional healthcare conglomerate that operates in 7 states with hospitals and nursing homes that is already scheduled for purchase evaluation. And for those on this call that are involved in facilities, I encourage you to contact us to set those up, since we do have limited supply as we work towards scaling into full-scale manufacturing in the second half of the year. And so this is our M&A plans and growth plans. We're raising $5 million in capital now and believe we can become highly profitable. These potential acquirers in the field, I've talked to most of the CEOs and heads of business development of these companies. They acknowledge this is a massive problem and that we appear to be on the right track of tackling it. They're eager to see our progress with penetration and commercialization. And then we could also raise a $10 million Series B round after the A and further expand globally. And so with that, I welcome you in helping us achieve our mission to restore independence to those who suffer from mobility challenges and best protect caregivers from encountering patient lifting injuries. Thank you so much.
Thank you for your presentation. I am curious if you are getting most of the traction from B2B or B2C, and also if everybody is paying kind of like out of pocket or sponsoring by themselves, or if there's any potential to be reimbursed by payers. And actually somebody messaged me and suggested that the mobile chairs have been a huge business because they do have Medicare support. So is that something that you see potential for getting, financial support
Sure.
from Medicare? But I'm also thinking like Medicaid and other kinds of payers.
Yeah, I mean, this really just has to do with the youth of our organization. Bria can show you a slide which summarizes insurance reimbursement. There's actually an existing Medicare code. And so we just have not filed for that yet because we want to have capital, which would allow us to have inventory and customer service infrastructure. Of the inbound demand we're getting, to answer your first question, which is mostly B2C, because that's where our marketing has been geared toward. It's so inexpensive. And also because for 1.5 years, we really couldn't step foot into a facility. If we're not getting a deposit from an individual, it's one of 2 reasons. We don't have inventory to ship immediately, or because they are asking about Medicare. Now, we just recently are introducing our capital leasing and financing strategy, which again, even with the use of care credit, they want to see us having inventory in hand so that they can provide consumer financing for B2C. But our traction as far as orders go is B2C mostly. But for this year in 2022, I see that definitely accelerating in institutional facilities now that we're getting manufactured inventory and can leave units at facilities for longer trials and purchase evaluations.
Thank you. Do any of the other judges have a question?
So Craig, your presentation is absolutely fabulous. It's very engaging. I didn't sleep during the presentation, big deal. I have a couple of very simple questions. I love the logo, I love the meaning, I love the mission, so very well done. The questions I have are very simple, like what is the manufacturing unit life cycle when you make this whole thing? How long does it take to make?
Yeah. Yeah. So I would say there's two answers to that question. There's the now and in 6 months from now. And the now is impacted by again, we've been minimally capitalized, and also just the dynamic of supply chain challenges around the world. So I'll answer your question really as far as how we've scoped this out with different contract manufacturers as far as our full scale production, which is really how we're going to be operating as a company. There really is no part of our device that is more than a 4 or 6 week lead time. If we're going to say, hey, I want to produce 500 units and engage the supply chain, it should be a 4 to 6 week process. One of the beauties of UpLyft, and this is intentional, this has to do with some of my experience in previously commercializing an FDA regulated product. We do not have software. That's intentional. We do not have chips, so we don't have to deal with chip shortages. And so you're talking about cables, motors, actuators, pulleys. These are still even readily available. And so today, as we're pushing out our 20 units that we expect to come out in March, I mean, we're ordering tooling for the first time. So yeah, that's about 10 weeks. But you know, when we have our 5 million round, we're going to order a tool that can produce thousands of units. So we're not going to be waiting for tooling all the time. So I think the expectation in full scale production is fair that this is a 4 to 6 week lead time.
And it's going to manufacture in the US?
Yeah, so we currently are manufacturing in small volume in San Diego with a medical device contract manufacturer. And they specialize in this beta, gamma, low volume build. But if you get to over 100 units, we need to go elsewhere. And so we already started embarking in Q4 in an RFP process, and that will be undertaken in greater earnest in February and March. This can be manufactured in the United States. We do not anticipate this being an immensely high labor a labor component. And so we'll know more in February or March when we go through the RFPs with the different contract manufacturers. But we have had one that scoped this out in full as it relates to full scale production. And even though you didn't ask the question, some people ask, our cost of goods all in, including indirect labor, direct labor, scrap, is really, it should be only $1,750 a unit at production volumes of a minimum of 500.
And just a closing question, is it a battery operated or electrical?
Both. So, Bria, can you put up the slide with the hoist that I love so much? So many doctors are familiar in hospital facilities with hoists. Many are familiar with the brand Hoyer from Jorns. And so Jorns lifts are electric. And so what you can see on our device, and Bria, there's maybe another slide of an UpLyft where Todd's hands are, where we can see the battery. There is battery supply of our UpLyft. So the hoist moves, allows you to move side to side essentially, or up and down. But the articulation of what I sometimes call your own personalized ski chair, which is what UpLyft really represents, that is battery powered. And today in the prototypes, we were just using off-the-shelf batteries from Lowe's that would be no different used in power tools. And our contract manufacturer now is going through a supplier vetting process with the battery to make sure we're FDA compliant.
Thank you.
Wonderful.
Thank you, Vince.
Looking at the